from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we continue the mental health mini-series. Today, we're discussing trauma and grief, which can impact people at any age, really. Our guest today is Stephanie Iacopelli, Manager of Behavioral Health Services at the Cornell Behavioral Health Pavilion at Sarasota Memorial. Stephanie, thank you so much for joining us.
It's a pleasure. Thank you for having me.
Let's start with the basics. What exactly is trauma, and how does it differ from everyday stress or hardship?
So trauma is a term that we hear all over the place. You know, people are always saying, oh my God, that's so traumatic. You know, I'll never do that again. It was too much trauma for me. So it's a flippant statement that we hear every day. But in terms of clinical trauma and in terms of trauma as opposed to like regular daily coping and stressors, it's part of the human condition that we are destined to have discomfort in life, okay? It creates, decision making. It creates us to prosper and learn and grow and all of those normal things. But when we're really talking about trauma, it is something that has affected you over and above, kind of like a ripple effect like in your life.
So what are some of the different types of trauma people can experience? I know I've heard terms like acute, chronic, or complex. What are those?
So an acute trauma is something that happens as a one-time event. For example, a car accident, natural disaster. It's a one-time event that somebody experiences, and then that's it. It's not a sustained thing. Where chronic trauma is something that is more sustained. So you are experiencing that stressor or that situation for a lengthier period of time. Beyond that, there is also complex trauma, as you mentioned. That's something that we see manifesting a lot in childhood. So complex trauma is something that happens, like, let's say, for example, as byproduct of abuse and neglect. Child has been exposed to perhaps, years of ongoing stress that way. So that would be more of a complex situation.
Understood. Can trauma stem from experiences that might not seem traumatic to other people?
Yes. So let's say, for example, you and I, it's a beautiful Sarasota day, we're strolling down the sidewalk, and on the opposite side of the road, we might see somebody walking a dog, okay? Suddenly that cute little puppy gets away from the owner, crosses the street, and you and I both witnessed that little cutesy puppy get hit, okay? You might take that experience and you might feel bad in the moment, or you might, have a reaction right there, but you'll probably go home, you'll sleep good that night, you'll wake up the next day, normal life. I may experience that same event that you and I both experienced together, and I may never forget that image in my brain. I might not sleep for days. I might be hypervigilant then with my own dog. I might put 5 leashes on my dog, for the next 5 years. So you and I will observe the same exact thing. You will be fine, okay? Nothing impairing. I will carry it and I will end up having a difficult time. So that's like kind of an example.
Is there anything that predisposes someone to a more traumatized reaction to the same event like that example?
So I like to talk about resiliency when I'm talking about how we cope with things. And sometimes some of us are a little more resilient to having things happen to us than others. Some people are wired a little bit differently to be able to take a situation, be able to cope with it in the moment, or be able to rationalize something, where others might not have as much resiliency. Why are some people able to go through horrific things, captivity or, things like that, and come out of it and eventually, go on with their life at some point, and others aren't? So resiliency is something that is really unique to the individual. And so really, even in therapy and as a therapist, we try to tap into that a little bit. What is the resiliency of this person? What is the likelihood that they might be able to work through?
How does trauma affect the brain and body over time?
It's a good question. So we know through studies that trauma, especially untreated trauma, if it's ongoing, physiologically can have all kinds of effect on our sleep patterns. It can cause chronic pain. It can cause GI difficulties, and even progress into on the mental health side, post-traumatic stress disorder. On the mental health side, it can have a huge impact on depression, anxiety. It can create a lot of other mental health disorders based on that.
How might childhood trauma differ from trauma experienced in an adulthood?
So children's brains are not fully cooked or fully developed yet, okay? So the childhood brain does not have the same coping abilities. They don't have the same rational brain mechanisms that an adult would have. So with a child, they're going to experience a traumatic event, and they're not going to necessarily be able to tap into resiliency at that point or tap into a coping mechanism. They might not have the free will to exit the situation or change their environment. Whereas an adult can rationalize the situation a little bit more. They can make a decision if, let's say, it's an abusive situation or they're in a domestically violent relationship, for example. They can make a decision to get out of it or do something about it, whereas a child really doesn't have that ability.
Now, in a behavioral health setting where a child might be treated for trauma of some kind and an adult, does the treatment differ for children versus adults, or do they have different abilities to recover after trauma?
So there are different modalities of treatment for trauma based on child, versus adult. Pretty much cognitive behavioral therapy, or CBT we call it, is the main modality to treat any kind of a trauma. With children, we like to use what we call TFCBT, trauma-focused cognitive behavioral therapy. That modality calls upon trauma memory. It gives a narrative. This is just very on the surface of what that is. It gives a child a narrative and also brings in the caregivers to be able to be part of that recovery and be part of that healing process. With adults, we use what we call, this is another modality for adults, would be EMDR. So it's eye movement desensitization modality that uses rapid eye movement. And again, this is just very much on the surface of what that does. Rapid eye movement, as the person is recalling the memory, it acts as a way for the brain to rewire the memory so that when it comes up, it doesn't re-traumatize that individual.
That brings us to the idea of triggers. Can you explain what exactly a trigger is and how someone might recognize what their trigger is?
Sure. So, for example, let's say a woman was in a domestically violent, relationship, and she has trauma from that experience. She might be with a group of people, or let's say she's in her workplace and she might be at the water cooler and there's a little bit of a line behind her, for example. Let's say somebody might just kind of like brush against her, tap her on the shoulder, okay? Just that movement of not knowing who's behind her and that touch can cause her to bubble up a trauma memory in that moment, and she could literally be right back to the events of the past. It's important for people to understand that a trauma memory, and when we process a trauma at the time of the trauma, it doesn't happen in a sequence of events. So the brain doesn't store it that way. So when we have a trigger, we are thinking that we are right back in the time that the trauma was actually occurring.
What are some common trauma responses, and how do they show up in daily life?
So startle reflex is one. Hypervigilance in environment is also a common one. Not really feeling safe all the time, that hypervigilance. It could be something where, let's go back to the dog scenario that I talked about earlier. Let's say, you're walking down the street and you glance and you see somebody walking a dog, but it's the same color dog that you experienced that event. You will be triggered by that, just that vision and just that visual, and then be right back to the day that dog got hit. So it could be something just like that, in just not even meaning for it to happen to you.
How can friends or loved ones support someone who's been triggered without overstepping boundaries? Because that's a huge problem.
Yeah, that's a really good question. We definitely don't want to say things like, "What's wrong with you?" or "Get over it," or something like that. We want to make sure that the person is feeling safe, that we're there to support them. It's important to try to ground them as much as possible, just so that they don't feel, that it's going to create, again, a trigger even more so for them. So any way that we can use grounding techniques, any way we can reassure them that they're in a safe place, that they're, not alone. So all of those things are really super important for people that are in that supportive mode.
How can someone tell if their trauma is something they can process on their own, or maybe they do really need professional help?
So with trauma, just like with any mental health, issue that a person might be experiencing, when it starts to interfere with daily life, when you're no longer able to get up in the morning and do your routines, when you're not able to get to your job and function, adequately, when, daily tasks are challenging. For example, someone who has experienced trauma from a motor vehicle accident, let's say they were the driver, many times they go into avoidance. So avoidance is a really big thing that we see with trauma survivors. They'll avoid situations, they'll avoid certain, scenarios. With a motor vehicle accident, they will avoid driving, or if they do choose to drive, they might be very, very tense about it. They might be very hypervigilant, like just expecting that something bad is about to imminently happen. So when those things start to creep in, when functioning normally and feeling joy and happiness and things like that, when those things start to creep in, that's really a signal that they really need to engage with somebody professional.
And are there any early warning signs that trauma is affecting relationships?
Yes. If a person is having difficulty engaging in relationships, and it could be casual relationships, it could be intimate relationships, it could be, folks that have been in relationship for many years that, suddenly, because of a traumatic event or because of a trauma experience or response, it could really impact those relationships. It might create somebody to become more irritable, argumentative for no reason. So it definitely, can manifest that way for sure.
So you mentioned a few kinds of treatment, but what are the types of therapy or approaches that are most effective for trauma recovery?
So really the cognitive behavioral modalities are the most, have the most positive outcomes. TFCBT is definitely one that I personally have used with children and adolescents that I know has positive outcomes. And the EMDR is also very, very, very outcome positive. But it's really important that people make sure that the practitioner is trained, because that's really a specialty and really requires a person to have gone through that training to really become certified to do that.
For someone ready to seek help, where should they start? Are there local or national resources that you recommend?
Yes, right in our local community, certainly Cornell Behavioral Health Pavilion. If somebody is feeling like they're entering any kind of crisis, they certainly can come to us 24/7 in our Crisis Assessment Center. for a free evaluation with licensed therapists. We'll be happy to sit with them and to, really try to assess with them what's going on. And, NAMI, the National Alliance for Mental Illness, as a really strong, presence in this local community. They have great resources for community members. Peer supports is another really important modality that's wonderful. A peer support person is somebody who has lived experience with, mental health issues or substance abuse issues. They are wonderful to tap into. They're not clinical, so it's a different kind of relationship, but they're the walking, talking, I was there where you were. And I am the person that you are seeing right in front of you that has been through and has gotten through it and has meaning in their life again. So super important for people to see a light at the end of a tunnel, for sure.
So that was peer support. What about group therapy? Does that play a role in trauma healing?
Absolutely. So what's wonderful about group work is that it gives people struggling a group of support that shows them, I'm not alone. There are other people that are going through the same thing. So in hearing people share their stories in a group setting, it's very healing. It's really very, I'm not alone. My goodness, look at all the people in this room, are also feeling very similar things. It's almost like, wow, somebody understands me, understands what I'm going through. And that's huge for the healing process.
Earlier, you mentioned resiliency and the importance of that. And I want to bring us back to that because I want to know if there are any daily practices that can help foster emotional resilience and healing for someone who may have experienced trauma, or even if you haven't, is there something you can do to build your resilience in case you ever do experience trauma?
Yes, so that's a great question. So we do build resiliency. I mean, resiliency is something that we can manifest and we can grow. So it is important to self-care, which is something that's really more difficult in society, especially with folks that are super busy. But really, self-care is so important. Taking time to be mindful and not mindful where, you've got to, do 10 hours of yoga every day, just being mindful, maybe just taking 5 minutes out to do something enjoyable. Maybe it would be meditation for, 3 to 5 minutes. It doesn't have to be something that's going to take hours of your time. Connecting with people, important to have those important outlets. Friendships are super important, outlets that are other people that you can share, your thoughts and your feelings, with. Friendships can be on surface or they can be a little more intimate, but having those really good buddies to just kind of like, chat with, things like that are really, really good.
So is there anything else you want to add specific to trauma or healing from trauma?
So I just want to add that it is absolutely something that can be treated successfully. It doesn't have to define you as a person. It doesn't have to cripple you. It doesn't have to steal life from you in any way, shape, or form. There are definitely, ways to work through it. And just to take that step to seek the help is really the very first step.
Thank you so much for joining us,
My
Stephanie.
pleasure.
If you liked this episode of HealthCasts, please like and comment and visit smh.com/podcast to listen to more experts talking about the health issues which matter to you. And as always, we encourage everyone in the community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.